Now, this story, the National Healthcare Professionals Association concerned about how the National Health Insurance, that's the NHI, will be run. It's concerned the NHI might also be looted and end up falling like other state-owned entities. Dr. Donald Gumede is chairperson of the association. He's joining us now from Johannesburg to share their concerns. Dr. Gumede, good afternoon. Thank you very much for your time. So you are worried that NHI, I saw a headline in another media saying that will become the ESCOM or SAA of healthcare in South Africa. Why?
Because we are trying to solve problems which are getting bigger using the same solutions which actually have failed us many times. You look at your SOEs, like you rightfully said, they are failing because the way the boards are structured and who actually decides who has to sit in the board. And I mean, we must not be afraid to call a spade a spade. The PPE money, which was 500 billion, just disappeared on thin air to people's pockets. It's one good example. And I mean, if NHI is going to generate around 25 to 30 billion, and we couldn't manage a mere or 500 billion properly. I mean, let me give you a simple example. If we had donated 10 billion in each province to ask them to build hospitals, we'll have a good legacy of what COVID had brought in our country. We'll still have left with enough money to run the COVID project. But the money disappeared. And our SIUs and the ops and the police and the judiciary are doing nothing about it. So the problem is, it's not that South Africa cannot create good documents. They have done that, and like you know, the bill is in Parliament now for ratification in any way to say that it must go ahead. But then the implementation of the processes is what actually is of concern.
So what do you want? Sorry, Dr. Gumede, the implementation of the processes, do you want more transparency? Because earlier you were saying now, you're worried about how this state-owned insurance scheme, which will be the biggest parastatal, how it's going to be managed. So governance-wise, you're concerned about, also you're concerned, I guess, about possible political interference.
It is, of course. I mean, look at NEFSAS. NEFSAS now, it's on 7 billion rands looting. NEFSAS, imagine, something that's supposed to actually...
What do you mean? What do you mean? Hold on. What do you mean NEFSAS is on 7 billion rand looting? You mean that money has gone missing?
Yeah, it has gone missing. Just go and check. Yes, go and check. It's exactly like that. There's ghost students. Yeah.
Okay.
And it's
fine. We're talking about NHI. I just wanted to clarify that NEFSAS point you were making. So regarding this process of finalizing the setting up of NHI, because it's coming, what would you as health professionals would like to see happening so that there's transparency, there's proper governance, and there will be no corruption?
Yeah, very, very good point there. Actually, health should be, it is a right to every South African. And I honestly believe that it should be run by healthcare professionals, not by politicians. Because you see, it's us who are in the ground who deal with patients. I mean, now I'm going to work to deal with COVID patients. And I mean, the politicians, they're usually sitting in their offices and they don't understand actually what goes behind the scenes. I would appreciate it if the board of governance is not appointed by the minister, because that's where the problem starts, to tell the truth. Because now, even at the current situation, the minister is accused of vibes advertisement companies in his department, whilst we actually still have students actually who are, or doctor students who are sitting at home unemployed. I've got names of those people, and they are sitting at home. They say there's no budget, but at this point in time, the health department is able to symphony money to some advertisement. So we have a problem.
Okay.
We need to have an independent board of directors who run NHI, not the minister.
Independent board of directors, no politician on that board. Minister must stay out of it. That's what you want as health professionals. Very clear indeed. We'll have to wait and see what will come out from that parliamentary process in setting up NHI. Dr. Donald Gumede, chairperson of the National Healthcare Professionals